on that Broken Body series. And he's on the line. Doctor, morning.
Good morning. Sorry I missed you last week.
Last week I was not well, but now we are up and ready to roll.
Indeed, I hope you're much better. And we're winding our way through the mental health series and come to a close. And today we're going to be talking about panic attacks and generalized anxiety disorder. Now, these are very common mental health conditions that really can have a significant impact on people's lives. You know, I mean, everybody knows what a panic is like, and everybody knows when one gets anxious, whether it's an interview or an exam or whatever it is. But, you know, a lot of people have panic attacks just out of the blue. I mean, maybe you know, do you know people who have these sort of major panic attacks?
I wouldn't say so.
Do you know anybody that's just generally anxious?
Yes.
Yeah, that sounds very close to home. Well, it's actually a very common condition, and people sometimes don't recognize that what they're having is a panic attack. You know, some of them present people like me to the heart clinic, where what they have is palpitations, where they have a racing heart or a pounding chest. Some people have sweating, and they think they're having, if they're a certain age, they think they're having menopause. Others have a shaking, sort of trembling, where their fingers begin to shake, and some people even go to a lung clinic because they're getting short of breath. They can't take a deep breath in. They always feel like they're hungry for air, and often the general practitioner or even the specialist says there's nothing wrong with you, but they still have the sensation that they can't breathe. Others feel like, you know, somebody's choking them. Often in my clinic, people come with chest pain, and sometimes if it's on the left, they think they're having a heart attack. Others get abdominal distension or abdominal distress. They get bloating, they get nausea, they get dizziness. These are really common symptoms, and people often ignore them until it sort of really blows up into a major panic attack. And occasionally, because you're hyperventilating, where you're breathing very quickly, you can actually get pins and needles in your feet and your hands, this sort of bohatsu, you know, and this is what happens. And occasionally they present to psychiatry where they feel they're losing control or going crazy, and some people actually feel they're dying. It actually is a major issue, and can often take the guise of all these conditions which don't actually lead to a therapist. They lead to the emergency room, or they lead to, you know, a GP prescribing something that really is not necessary because they haven't actually hit the nail on the head with panic attacks. So this is really important to understand, and we're not sure why it occurs. Often trigger factors, but this is a really important thing. And now that I've mentioned these symptoms, do you know people who have those?
Yes. Yes.
Your passes are very short, because I'm hitting very hard home.
Very close.
Yeah. So together with panic disorder, the other one that goes hand in hand with that one is what's called a generalized anxiety disorder. And this is something that actually is very common. It's characterized by persistent and excessive anxiety or worry about, I don't know, a variety of things. And the people with generalized anxiety disorder have difficulty controlling their worry, and eventually it interferes with their daily life. And the classic symptoms that I've seen are a constant feeling of being on edge or anxious or nervous. You know, you can't actually understand, why am I so nervous? Why am I so agitated? They have an exaggerated sense of danger or doom. You know, something's going to happen. You know, I'm going to have a road crash. If I'm driving, the car next to me is going to bump into me. I can't have cars around me. They can't get into a lift because they think the lift is going to get stuck. They can't get into a combi taxi because they think they're going to suffocate because there's not enough air in there. At work, you have difficulty concentrating or thinking about anything other than the thing that you're worrying about. You know, and restlessness, fidgetiness. Some people get a lot of cramps and muscle tension. And often people just can't sleep because they're so anxious. They fall asleep, but they keep waking up. And this is really common, both the panic attacks and generalized anxiety disorder. And unfortunately, you know, if they go to an ER or casualty or emergency room, often what happens is they're just being given a painkiller or a sleeping tablet or, you know, some sort of tranquilizer without actually getting to the cause of this thing. So, you know, there are, the purpose of today's talk is to say to those out there that do have any signs or symptoms of this, that there are effective treatments available for both of these conditions which don't require medication. And ultimately, if you are not well, in spite of the things we're going to talk about, then perhaps medication is useful. But the most important one is the thing that therapists often use, psychologists, clinical psychologists use, or even psychiatrists use. It's called cognitive behavioral therapy, and it's a type of therapy that's really very effective for treating panic attack and anxiety. And what happens is the therapist identifies and works out what exactly is triggering it. People, for example, have had some trauma in childhood, or they've had abuse, or they've been involved in a road traffic accident, or they've had a burglary and beaten up at home or something by the burglar, and it constantly plays on their mind subconsciously, and that triggers a panic attack. And depending on the individual needs, people can actually go to a therapist and tease out what's going on and identify what's triggering both the anxiety as well as the panic disorder. So it's really important for people not to just take a chill pill that can do that. So a number of things that can help in general for people who have who have panic attacks and anxiety are the things that we always talk about. Getting regular exercise. This is a great way to reduce stress and anxiety. If you're stressed, take a walk. Honestly, it'll really help you. Just a 20-minute walk, if you have a dog, even better. It really just chills the system out and allows you to sort of blow out some of the steam. Getting enough sleep. We've talked about this before. When you're well rested, you're better able to cope with the stress and anxiety. And unfortunately, when people are stressed, they eat the wrong foods, they take too much caffeine, they take too much alcohol, they maybe take tobacco in excess, and these things actually trigger all sorts of things. You and I know that eating, comfort foods eventually makes you put on weight, and then you feel guilty, and that adds to your anxiety. So eating nutritious foods can help improve your overall mood. So it's really important, and avoiding too much coffee, energy drinks, these Red Bull toxic stuff, and Energies. I see Energies now come out with a sugar-free Energies. It's just a load of bollocks. It's all poisonous stuff. Don't use that stuff. It's just marketing. Alcohol and caffeine will worsen your anxiety. And of course, a therapist or your general practitioner or even a psychiatrist will teach you relaxation techniques, deep breathing, meditation, dare I say, can all reduce your anxiety very naturally. So it's really important for people to understand that these things are readily available. I'm going to pause there. Do you have any questions?
Who is most affected by this?
That's a really good question, and it is actually much more common in women than in men. I guess because women talk about these things, I think men have as much as anxiety, but they never come and tell the doctor, I'm feeling anxious, I'm feeling restless, I'm having panic attacks. But women often come to the clinic to say, I feel jittery, I feel like I'm panicking, I feel anxious all the time, and so they often seek treatment for most conditions besides this one as well. So I think it's statistically more common in women, but I suspect men have it, but they just not talk about it. Generally occurs early in teenage years, and it can go throughout life unless it's addressed, and can be really incapacitating, where you can't actually even get out of the house because you're so afraid of whatever it is you're afraid of. And you can't even go for an interview for a job because you just become so anxious. You forget your lines if you're practicing for something. You've forgotten, what you learned the night before for your exam. And it can really be very incapacitating for anybody of any age. You can imagine, a tertiary school student forgetting the night before a revision and just ending up totally panicking in an exam, and not a reflection of what they know, it's just a reflection of the current state of anxiety. So a lot of people get this stuff. And I say also to remember that these drinks we talked about can trigger anxiety. If you take too much tea or coffee, if you take too many energy drinks, these things can actually make your heart tremble, can give you shortness of breath, can give you dizziness, can so people don't realize sometimes that it may be the things that they're doing that's causing this anxiety. So look at your lifestyle to see what's going on there as well, And I do want to mention that, if the things we've mentioned don't work, the sort of, exercise and sleep and diet and avoiding caffeine and alcohol and learning to sort of chill out, you need to reach out to a mental health professional for support. It's not an indictment on you. People don't like the idea of seeing a therapist or psychiatrist, but post-COVID, where we had, after lockdown, we had a lot of anxiety because people were just locked up for weeks and weeks and weeks on end and got really anxious, got depressed. There was, as you know, a rise in suicide. So there has been an opening of the window onto mental disorders, and particularly this type of disorder. So, speak your mind, ask your doctor to refer you if you need to be referred to a a therapist or even to a psychiatrist, because there's no harm, because it can actually make you feel and function much better in society, you know. And of course, you know, last but not least, if these techniques only partially work, a psychiatrist will give you something to stop your anxiety, and there are lots of things on the market. They're all prescriptive drugs, so you'll need a prescription from a doctor or a psychiatrist, not a clinical psychologist, where it calms the brain down, it slows the heart rate down. In my profession, we give you what are called beta blockers, which actually slow the heart rate down so you don't feel so anxious. And these things do help in the short term, but long term you need to get to the grips as to why this condition occurred, where did it come from, and sometimes it runs in families. You know, if you have anxious parents, children tend to look at that anxiety and actually often mimic that anxiety. So, you know, so look at your parents and you think, so it may not be genetic, but it may just be the environment in which you've grown up that makes you anxious. So that's really important. Of course, one of the things that a therapist did tell me yesterday to mention on air is that sometimes simple things, particularly at school, where children are bullied, you know, bullying can result in anxiety of a child not going to school, having panic attacks, failing their exams, and it may be not the child, but the environment of the school or somebody there that's actually causing havoc and trauma to that particular child. So it's really important to uncover these things rather than just, you know, go and take a chill pill. But often we can actually get to the bottom of it and say, Kante, this is the cause and this is how we need to treat it, you know?
Okay.
So next week we're going to wrap up and we're going to talk about the most serious of mental disorders, and those are the ones that actually you see on television, things that we call organic psychosis, which basically means schizophrenia, manic depressive disorders, the things that actually often we actually need to refer to sobrano or to psychiatrists, sometimes to actually admit them into hospital because they've gone a little bit loopy, and we need to understand what is causing it, why does it occur, who gets it, does it run in families, and are people able to function in society effectively with treatment. So that's the end of our mental health series next week, and then we'll move on to something else. So look forward to seeing you again next week.
Always a pleasure, Doctor. Till next week.
Thank you.
Bye-bye. 10:49 is the time. 10:43 is the time on over to your station of choice. That was Dr. Birgit.